Hi, welcome to Fertility Talks, and I'm Mary Wong, and tonight we are going to talk about AMH, which is anti-Müllerian hormone, and what is it, and how is it related to your fertility. And before we go on to the depths of this conversation, which I'm so thrilled to have Dr. Garcia here with us.
Thank you.
I'm going to explain to you just for a sec why we're doing this. And this is the 133rd episode. And this is a conversation that's really dear to my heart, not just because I treat women for fertility, but I actually went through fertility issues. And during my time, I certainly found it a challenge to get correct, information, accurate, research-based, up-to-date, and with sound information coming from professionals alike and people that have gone through it themselves. So here I am covering it all, okay? So that's why we're here.
Okay.
And if this is your first time watching us, I'm a doctor of traditional Chinese medicine, and I'm the founder of a live holistic health clinic in downtown Toronto, and the author of Pathways to Pregnancy. So without further ado, let's bring on Dr. Garcia. Thank you for being here.
I'm very happy to be here. Thank you for having me.
I'm so thrilled to have you here. And I ran into Dr. Garcia when I was interviewing another physician at the Markham Fertility Center, where she has been practicing for 8 years.
8 years,
correct?
Yes.
And prior to, she's got like a gazillion awards. I looked at them all. I'm like, oh my goodness, how can I, let me say some of them. So she is a infertility specialist. I guess that would be obvious. And she did her medical degree and specialty training at University of Western Ontario. And she's got a gazillion awards, prestigious awards, the Governor General Academic Medal, the Institute of Medical Science Academic Award, the Medical Biophysics Academic Award, the Helen Mildred Allison Academic Award. So the point is, she's got it covered. I think we can trust her, really, right? So stop Googling and just know that we've got pretty good information. Okay, so I guess the very first question is, for those who don't know, what the heck is AMH?
Mm-hmm. Well, AMH is a very important test that I think most fertility patients should really have. It's basically a blood test that helps your doctor determine your ovarian reserve, and in other words, the quantity of your eggs. The great thing about AMH is that it can be done at any time of the cycle, so it doesn't matter whether you're at the end of your period or the beginning of your cycle. It can be done at any time, so it's convenient from that point of view. It's a simple blood test, and it's very helpful, and I'm going to talk a little bit more about how it can be helpful.
Okay, so if you're not at a fertility clinic, can you still get it done?
Yes, you can go to your family doctor and ask them for an AMH level. The only thing I would caution, and this is why I really wanted to do this talk, is that AMH level is a little bit tricky to interpret. It is important to really understand what it is and what it is not. A lot of people say it is a fertility test, but it's not a test that tells you whether you're going to get pregnant or not, and that's very, very important to understand.
So great, and I love that you say that and put that first thing in, because people are focused on their numbers as if this is the number that is going to show me I'm going to get pregnant or not, and that's not it.
That's right. An AMH level absolutely should not define you, and it definitely should not define your fertility. There's so many other aspects of your fertility test that can really help your doctor give you an estimation of your likelihood of success through the fertility journey, but the AMH level alone should not give you the entire picture.
Absolutely, and I really want to acknowledge you for saying this, because I cannot tell you how many times women come in crying.
That's right.
And devastated. It's like, oh my gosh, my AMH is low and I'm not going to get pregnant. I'm like, wait a minute, that's not true.
And that's why when you say, can I just get it done anywhere, even if I'm not a fertility patient? Yes, you can, but again, it's one of those things where knowing a little bit of something, it's not great. You really want to understand the big picture. So if you're going to get it done outside of the context of fertility, then you want to make sure that your provider is able to explain it to you, and you want to make sure that you really understand what the test is doing for you.
Yes, and what it really does mean, right? Okay,
that's right.
So great that you start here. I have to tell you guys, because I'm in the natural medicine field, so I was worried she was just gonna just put cautionary, Anyway, I'm actually really, really, really impressed that you're saying this as the first go. So thank you.
You're welcome.
So I guess though too, what I want to clarify, because there are two systems.
Right.
Right. So some people come in, they'll say, "Oh, my AMH is 0.4." I'm like,
Right.
"Well, 0.4 what?"
Right.
Like
Exactly.
which? So can you explain a bit about that?
Super important. So here in Canada, the AMH level can be done at Life Labs, and Life Labs does it in picomoles per liters, and Gamma Dynacare does it in nanograms per liter. So it's actually two separate assays. So it's the comparison. You can go on Google and you can convert nanograms to picomoles, and there are tons of calculators there, and then they can do that. But because it's a different assay, it's not an exact conversion. So I think it's just really important to understand, like you said, when your doctor says your AMH level is 5 in nanograms per mil is huge, it's super high.
Yeah, absolutely.
And 5 in picomoles per liter is low.
Super low.
So, super low.
Yeah.
So it's really important that you really understand what unit. So whenever my patients say, "Can you tell me what my level is?" I tell them the number, but I say, remember the unit more than the number, because when you go out there and start asking questions and Google and things, it's really important to understand what unit it was done in.
Okay, perfect. So then, I don't want to talk about numbers too much,
Right.
but let's just throw it out there and say on that blanket statement it's low. Okay, so what do you do with that?
Okay, so there are two parts of understanding your ovarian reserve. There is the quantity of your eggs and the quality of your eggs. So AMH level is only a test of quantity. I cannot stress this enough. It's only a test of quantity. So to make a baby, you need one egg, one good egg, not 100 million eggs, one good egg. So the AMH level doesn't tell you whether you have one good egg or not. The AMH level only tells you that you have a lot of eggs, good or not, we don't know that based on the AMH, or not a lot of eggs, good or not, we don't know that based on the AMH.
Where'd you come from?
Migrant Fertility Center. so if you have a low AMH level, the most important piece of information is how old you are, right? Because that is what determines the quality of your eggs. So if you're a woman who's relatively young, let's say 30 years of age, and you have a low AMH level, that does not say that you cannot get pregnant when you're 30 years of age. All that says is that if I were to do IVF for you, because I had to do IVF for other reasons, not because your AMH level is low, I know right off the bat that I'm not going to be getting 20 eggs or 30 eggs in one cycle. I also know right off the bat that I have to give you high doses of medication to get the probably 7 to 8 eggs that you're going to get in that cycle. So the AMH level is very powerful in being able to set the expectation for women about their IVF cycles, how many eggs you're going to get. It's very important for the doctor to understand what dose of gonadotropins to give you to get as many eggs as possible. And it's also important for the doctor to know whether you are at risk of ovarian hyperstimulation or not, because when your AMH level is really, really high, then your doctor has to start thinking, okay, I better not give her tons of medication.
That's
and
right.
I better monitor her estrogen level very closely, because I don't want her estrogen level to go very high and for this patient to overstimulate and then have all the complications associated with ovarian stimulation syndrome. So that's really all it does. It tells your doctor how many eggs you're going to be able to get in an IVF cycle and whether you are at risk for ovarian hyperstimulation. Now that is extremely important, because in the old days before the AMH level, we would look at a woman and say, oh, you're 30 years old, I'm going to give you a low dose of medication because you're really young and you're probably going to do well, and then you have 3 follicles and you have 4 eggs, and you're thinking, your doctor and the patient are both thinking, what on earth, like what did we do wrong?
Right.
So now with the AMH level, we can have that conversation right off the bat before the stimulation starts. We can have an understanding of what the expectation is, and then we can go from there.
So that's great, because then really it's giving you insight about
That's
your
right.
protocol,
Right.
so that you maximize your fertility
That's
IVF cycle.
Exactly.
So I need to add in this piece though, right? So not everybody's doing IVF. So
Right.
the other thing is when you get your AMH tested and it is low, again, it's not like, oh my gosh, you know, this is lost cause, I'm not going to be able to get pregnant.
Not at all.
So how I see it is, yes, there's lower numbers, and really what we want to do is maximize and optimize what you've actually got there.
Right. So that's the second part of it. So the first part is saying, what am I going to do? If you're going to do an IVF cycle, how many eggs am I going to get? So that's the first part and the most important part. Now, but the second part to that is also being able to, for your doctor to have an understanding of the big picture. So you might be coming in and say, you know, I'm 34 and your AMH level is low. Well, now your doctor can have a conversation of, okay, so we know that you could get pregnant tomorrow. Your AMH level doesn't change that, but how many kids do you want to have, right? Because you get pregnant tomorrow, that's great. Then you have a baby, you breastfeed the baby, because I'm big on breastfeeding. And then...
That's a different conversation.
That's a different conversation, but no shaming.
No shaming, no shaming.
It's okay if you don't breastfeed. But now you're coming back about a year and a half and 2 years later, and now you're 36 or 37. And then the IVF that you didn't need back in the day, you might need it now. But now your AMH level is really low, and now you're only getting 2x or 3x. So it's really a great conversation to have. Not to say you're going to get pregnant or not going to get pregnant, but if your AMH level is low, then you can start thinking long term. That might be a reason to do IVF maybe a little bit sooner, just to be able to get your eggs on this side of the equation, to get your embryos created, and sort of thinking about the big picture.
If you're wanting
to have multiple children.
If you want a gaggle of kids, yes.
Right.
If you want 6 or 9 kids, this is what you do.
But not everybody. Single, you know, if you're single as well, right? Like I see that a lot. So women are 32, they're single. I don't really think I'm gonna have a partner for a while. You do an AMH level and it's low, and then you can start thinking, okay, I better freeze my eggs. I know I should be freezing, maybe doing 2 freeze cycles so I can have 10 to 15 eggs. And if I cannot get it in one cycle because the AMH level is low, then I should do multiple cycles. So that's how the AMH level is useful. Right. Never, never, never determining whether or not you're going to be able to get pregnant.
Yes, and we have to add in then, and you just covered it. So sometimes you may want to have multiple rounds of IVF retrievals, right, to get the right number of embryos so that you have a higher chance of conceiving a baby to term.
Right, absolutely.
Right? You know, we always say pregnancy, but really what we want is live birth, like a baby in your arms.
Exactly.
So that's why they account for a certain number of embryos to kind of give you more of the insurance, I guess.
Right. And for some people, it's more than one baby in their arms, right? Yeah. So we always have to look not about, I want to be pregnant now, but what is my family planning ideals and what it is the things that we want. Because a lot of times it's easy in fertility to concentrate on that 2 lines of the strip right now, but then you come back with the baby and you want to have another one. And, you know, we really, when I meet my patients, I always ask about the long-term plans, how big you want their families to be, because that really can help in planning your treatment cycles.
So I hope it doesn't stress you out too much listening to that, because, you know, it's hard enough thinking about the first baby, and then to actually think about having a second one, it can add a level of stress. And just for those watching, it's the first time we're doing it outdoors, so I apologize for the plane that's flying overhead, which you might hear. Hopefully you can hear us still.
It's a beautiful day outside, so.
So we want to talk and like have it be done before it gets dark.
That's right.
And before all the mosquitoes start biting me.
That's right.
Okay, so you already mentioned it in terms of hyperstimulation, but you know, can you also talk or speak to the potential of some condition like polycystic ovaries with the AMH?
So AMH hasn't been put in the criteria yet to diagnose polycystic ovarian syndrome officially, but I think most fertility specialists do recognize that when a patient has a high AMH level, I'm talking 40 picomoles per liter and higher, then there is a very, very good chance that that patient has polycystic ovarian syndrome. Of course, we still have to look at other factors like irregular cycles, hirsutism, which means having issues with acne or abnormal hair growth, the appearance of the ovaries, and all those other factors as well. But generally speaking, a high AMH level is a fairly good predictor of polycystic ovarian syndrome.
I just want to add that in there, right? So that people don't forget.
Right.
I think we covered a Yeah. Is there anything else that you want to cover?
Yeah, I guess I want to go back a little bit. So I talked about how AMH is an assessment of ovarian reserve. So I want to go talk a little bit more about ovarian reserve, because I think this is really important. It's what I spend a lot of time talking to my patients. And if I can help just one person sort of understand this, then my job is done.
That's why we're here.
That's right.
That's why we do these talks.
So the analogy that I like to use for the patient is the bag of orange analogy. So imagine that your ovaries is a bag of oranges, and if the bag is really full, that you can pick it up and you're like, oh my God, I can barely carry this. That is like the AMH. That is a test of quantity. So you can pick up the bag and you know it's heavy, and you know, okay, there's lots of oranges in there. So if you don't open the bag, you have no idea how good the oranges are. So if those oranges have been sitting in the warehouse for 6 months, you can take home your bag full of oranges, really full, high AMH level, but when you open the bag, the oranges might not be fresh, or might not be the kind of oranges that you really want to eat and enjoy. So quality and quantity are two completely separate concepts. On the other hand, you take this bag of oranges, you pick it up and you go, oh, that's not very full, there's probably like 10 oranges in there. But if I just pick them off the tree, you're gonna go home with those 10 oranges, you're gonna open the bag, and guess what? You're gonna have the best orange juice of your life.
That's
right? So it's really important to understand the difference between quality and quantity, because again, you need, and I always say, are you looking for orange juice, or are you looking to have one good orange, right?
Yeah.
So you might not be able to make orange juice out of a bag of oranges that has been sitting in the warehouse, but as long as there is one good orange in there, if your goal is to be able to cut the orange and eat it, then you might be able to find it. You just have to be aware that you're gonna go orange number 1, orange number 2, orange number 3, and it might be orange number 10 that is actually gonna be the orange that is a good one. So it's important to understand the difference between quality and quantity, and what AMH is actually giving you.
I think it's really great. And of course, I would have to add in the piece about Chinese medicine, because we do lots of acupuncture to increase the blood volume to the ovaries. And there are theories, and I've actually witnessed it with our own patients where they have not done acupuncture. And we're talking not just a pre and post IVF acupuncture, we're talking doing stimulation of the ovaries and ovarian blood flow prior to and during IVF cycle. So typically we tell people for a good 3 months, because when we increase blood volume, there's a higher chance of increasing nutrient uptake, oxygenation, and even cellular energy, a mitochondrial ATP we call it, right? So if we can enhance that, then perhaps with the IVF, we're actually, or even naturally, we can help to enhance the quality of that orange, that juicy orange. Right?
And the other thing I want to say about AMH is that it can be suppressed if you're on the birth control pill, or if you are having an IUD that secretes progesterone, like a Mirena IUD. So I always tell my patients, we can test it when you're on the pill, and if it's super high, wonderful. But if it's low and you're on the pill, we're not gonna cry, we're gonna get you off the pill, wait at least a month, and repeat it again.
So so maybe I forget the research, but there's some research out there that even says that the suppression post-pill can in fact last for up to like 18 months.
I don't think 18 months. Usually the suppression post wouldn't last that long, because return fertility is pretty quick after the birth control pill.
But I think it can also be individualized, though.
It can be individualized. So that's what I always say to the patients. Sometimes we'll do it and it be perfect. So, you know, even if it went from 20 to 15, who cares, right?
Yeah.
But if we get it back and it's 5, then I would certainly repeat it. And again, obviously patients don't have 18 months to wait to repeat their AMH level. So I repeat it, like I usually say, wait a full menstrual cycle, like a natural menstrual cycle, to repeat it. And then if it's still low, then we can repeat it again to see if there is at least a trend. Going back to your question of how long does the suppression last, nobody really knows the answer to that question. So we'll repeat it again. If it's consistently low, then we probably have to admit that the AMH level is low. Another thing that we could do to help interpret the AMH level is the anthrofollicle count, which is basically doing an ultrasound of the ovaries, where you're actually looking at the ovaries with ultrasound and you're counting the little follicles in the ovary that are eventually going to be eggs. So in a situation like this, when I'm not really sure if the AMH level really is low or is being suppressed, an follicle count can also be done, but that is also suppressed when you're on the birth control pill.
That's right.
So you have to
Exactly.
you have to be very careful with that.
Yeah, so, and I'm really grateful that you're bringing that point up too. Just because, again, you know, when we do tests, it's a point in time.
That's right, absolutely.
So it's not necessarily a permanence, right? But we typically look at numbers and measurements as if this is as best as it can be, and that's it. And meanwhile, things can shift. And I've actually witnessed people's AMH go up despite the pill, like not even the pill, or just naturally. I don't know if you've witnessed that yourself.
I've had once, and I don't really understand what happened there, but most of the time...
Acupuncture! That's what it is!
Probably. But most of the time, it does tend to come down with time. But
Sure,
it doesn't
of
come
course.
down month by month. It's usually like you see a decline over the years. It's not like it doesn't come down that quickly.
Yeah, it's not like if you're, 35 and next month you turn 36, all of a sudden your
not like
AMH
that.
is going to go
Not
down,
at all.
right?
No.
Okay, so there's a question by Melanie. Hi, Melanie. Thank you for being here. If someone has an AMH of 80 at the age of 26 and wants to possibly freeze eggs in the next couple of years, do you recommend a repeat AMH?
An AMH of 80 is really high, so I would be very worried that this person has polycystic ovarian syndrome, and I would also be very worried about her risk of hyperstimulation. Now, we have things that we can do to minimize hyperstimulation, and I'm not going to get into that. But I think, so two things. Yes, I would recommend repeating the AMH level just to see what is happening there, since she's not freezing her eggs right now. I always like to do the AMH level sort of fairly close to when the cycle is going to happen. Doesn't have to be within a month, but at least within that year. So from that point of view, I would certainly recommend it. But again, the decision to freeze the eggs really should be done based on age, not based on AMH. So if you're 34 and your AMH level is perfect and beautiful, and you're telling me I will not likely meet somebody or plan to meet somebody or plan to start my family until 6 years from now, it doesn't matter how great your AMH level is, you really need to think about freezing your eggs. So again, it goes back to not being fooled by high AMH level. You shouldn't be depressed about a low AMH level because it doesn't define your fertility.
Right.
But you also shouldn't be fooled by high AMH level thinking my AMH level is great, I can have kids when I'm 40 years old, because unfortunately that doesn't really work like that.
Yeah. And it depends on the person. And the tricky part is when you're in that predicament and you're single, it's a really difficult decision.
It's so hard.
Right? And especially when ideally you'd rather freeze an embryo, and who's going to want to freeze an embryo? Right? And the reason why I say that, as you know, is unfortunately it's way easier to freeze an embryo than it is an egg, even though vitrification
has really changed.
Yeah, it has changed,
yes.
But still,
it's still, if somebody comes to me right now, and this happens all the time, and they say, I have a partner, I want to freeze my eggs because we don't want to start. I say, well, no, if you have a partner, you want to freeze your embryos because it is still better. But again, vitrification has changed over the years, and if you don't have a partner, it is really much better to freeze your eggs than to not freeze your eggs.
Well, I had a lady recently, and I thought that was not a bad idea. She actually had a high AMH and high antral follicle count. So I said, well, what's the possibility of you freezing half and half?
Right.
Right?
Yes.
So she did do donor,
that.
right?
Yes.
So donor sperm and froze embryos for half the batch, and then half the batch was frozen eggs. And then you have
Yeah, I think that's a great idea. It's a little bit more costly because now you're freezing the eggs and you're doing the IVF, and you have to have lots of eggs for that to work.
Yes.
And not everybody's lucky enough to have a high AMH level and being able to get 15, 20 eggs out of one cycle. But if you can, I think it's certainly a reasonable option.
Yeah. And so I hope you found this beneficial, and certainly, again, I guess the take home is that AMH does not equal quality. Okay, guys? That's the takeaway. Anything else?
It just shouldn't, exactly, it doesn't equal quality, so it does not define your fertility, it does not define your ability to become a mom. So there is a lot more information that you really need to gather before you sort of have a clear picture of what your chances of success are.
Oh my God, I love you. Okay, guys, this is what REI says
we
that?
Didn't even, we didn't even coordinate.
We didn't coordinate.
It was totally random.
Yeah.
I did change like 3 times.
Yeah.
We actually decided on this, but I had no idea what you would be wearing.
That's hilarious. I just came from work. But like seriously, guys, and I don't want to put a damper on things, but here's the reality. If you don't see Dr. Garcia, most of the REIs out there will actually, they don't give you the best news and how they deliver. And I love how you're saying it, because it doesn't make a person feel bad.
That's right.
Right? Like most people will walk away, go, oh my God, my AMH is really low. I won't be able to have a baby and I'm old. Right? But how you're saying it is like, no, even if your AMH is low, you can likely still get pregnant, and we'll have to do a different protocol, or we'll do it naturally.
Right. I have seen people with AMH levels of 0.5 come back pregnant.
Yeah,
I mean,
me
it's
too.
Incredible.
Yeah, 0.4.
So I've never, it's really, really important to understand. Yeah.
Okay, guys. So if you're ever depressed about your numbers, call on her, or us, or anybody in the non-traditional field.
That's
but for traditional, holy moly, that's awesome. Thank you so much. Thank you
very much. Thank you, everybody, for watching.
Okay.
Wish you all the best in your journey.
And you know what? If they want to reach out to you, if you are local, you're at Markham Fertility Center.
Yes.
And the website is.
I don't know.
Just look it up. This is where you use Google.
Yes,
okay?
That's right. Google will help you.
Google will help you consult with Dr. Garcia. And otherwise, as well, if you want more free information, definitely watch all the posts from the past. So you can just go to marywong.life. Okay, this is the first time we're posting on Alive Holistic Health Facebook page, and because why not? And you can always contact me at Alive Holistic Health Clinic, and so you can just Google that. But if you want to see more of these kinds of interviews and insights, please just go ahead, check it out below, or oh no, not below, because it's on Mary Wong RTCMP on Facebook, or again, just go to my personal website, which is marywong.life, under the video section, and there's like 133 videos.
There's a lot of great videos there. I actually was checking you out. It's great, and I mean, it's exactly because I see it all the time, right? There is so much misinformation out there. So it is really a great resource, and thank you so much for doing this for the fertility community.
Thank you so much. I know, it's with passion. And you know, I see Susan Schiff is on here. Hello, Susan. I want to interview you sometime too, okay? Because there's lots to talk about.
Absolutely.
Okay,
absolutely.
Great. I would love to have you back another time.
I will be delighted.
Positive
Anytime.
force. I love
Anytime.
positive forces, because again, most of the time when people walk away, I don't know if you know this, but a lot of people, when they walk away from fertility clinics, they like come in, they see us, and they're like crying and devastated.
Right.
So you're a really great positive force. So I want to thank you.
Well, just like you, I went through fertility treatment myself. Both of my beautiful boys are from IVF, and it wasn't from 1 IVF or 2 IVF. It was 5 IVF. And guess what my AMH level was? Guess. 26, right? Amazing AMH level. Amazing AMH level. Tons of eggs every time. But quality wasn't really there.
Okay.
So there you go.
Thank you. Thank you for sharing that. See, it's so insightful. When you get someone who's been there, you get it. Okay, that's why. You get it. Okay, thank you. All right, we better get going, because people are going to get bored. And it's going to get dark in here, and we don't have external lighting. Okay, thanks, guys, for watching.
Everyone.
Take care. We'll see you next time. Bye.